My name is Michael Hudnut. I'm a head football coach and teacher in a high school, and I had double partial knee replacement done at the Core Institute by Dr. John Brown. Symptoms prior to seeing Dr. Brown were a lot of swelling on my knees, a lot of knee pain, to the point where I was taking a lot of anti-inflammatories just to get through a day. So the knee pain and the swelling were the two things that really brought me to talk to Dr. Brown about possible treatment options.
I became connected with Mike through our association with Willow Canyon High School. The patient was a coach for the Willow Canyon football team. We were taking care of, obviously, the players for that football team, and of course, being associated with the team itself, we were open to taking care of any of the members of the team, their parents, and of course the coach. Him being the coach, we started taking care of Mike.
The problems really started close to after when I graduated from college and had the opportunity to play football, and just progressed over the years until about 4 years prior to my actual surgery. Really manifested with a lot of knee swelling and pain, and that's where Dr. Brown brought me into the office.
Mike's problem started probably back when he was in college. He was a high-level college football player, actually played on the offensive line, and began having pain in the front of his knees at that time. He had sought previous treatment and had actually had some other treatments performed, but nothing seemed to relieve his pain, and so he sought further treatment with us.
It was a huge detriment to my daily life. The inability to get out of bed in the morning sometimes was very difficult. I felt like I was an old man where I couldn't stand up straight and walk. The swelling wouldn't allow me to get my knees where I could bend them and walk consistently. As a high school football coach and teacher, you spend your entire day on your feet. Going through practice sessions and things like that was very brutal. So the more I was able to, take the anti-inflammatories, the more I was able to get through it, but knowing that treatment was going to be needed.
Mike had constant pain in the anterior aspect, so in the front of both of his knees. He would have pain at night. He was unable to simply walk without pain. The primary symptoms that Mike was experiencing was anterior knee pain, and that's pain in the front of the knee. He had difficulty walking, climbing, stepping up on ladders, bending down, or even performing any of the simple drills that were required of him as the coach of the football team.
I had to have my knees drained several times just to take the fluid and the pressure off. I was given some injections of different sorts to try to alleviate the pain, and those would work for a short period of time, but then I would end up right back to where I was with the swelling and the knee pain after a couple months.
We took Mike through a multitude of different treatment options, to include corticosteroid injections, which are steroid injections that try to decrease the inflammation in his knees. Mike went through a knee joint replacement therapy to try to restore the function of his knees through non-operative approaches. Mike also went through a knee arthroscopy. Actually, we did a knee scope on both of his knees in an attempt to unload the patellofemoral joint, which is the joint in front of his knees, to give him some pain relief. Those worked for a period of time, but eventually we wound up in the same spot that we began. So Mike eventually, through several different treatment protocols, wound up getting what we call patellofemoral arthroplasty. Patellofemoral arthroplasty is simply a small joint replacement of the knee. It's not a complete knee replacement. It just replaces the patellofemoral joint with metal and plastic.
The change is, you really can't explain it. It's one of those things where you went from not being able to do anything on a daily basis to back to where I can almost do everything that I did prior. With the partial knee replacement, the ability to get back and exercise, which allowed me to drop weight, which was a huge part of what I needed to do. And just being a former athlete, the inability to not get in the weight room or not be able to participate in things was very difficult. So having that opportunity was a great change in my life.
I think the thing that really stands out to me in Mike's situation is not only were we able to kind of restore his function, we were able to kind of change his life. He was able to really get back into shape, drop a significant amount of weight, and become the functional young coach that he wanted to become.
The experience of the Core Institute is second to none, in my opinion. The staff from the front office all the way back to having the opportunity to sit with Dr. Brown and the personable type of people that they are really made it a great treatment option for me.
So the expectations of these patients that have this procedure are to return to their normal activities of daily living. If they like to run, we can expect them to return to running. If they golf, they can expect to return to golf, hike, any number of activities, whatever they like to do. The goal is to get them back to doing the things that they want to do without pain.
The most valuable aspect of my experience is the fact that I can now live like I'm 30 again and not my true age, and not feel like I'm 80 on a daily basis when I climb out of bed and start doing my activities.